says when it comes to behaviors, what behaviors should we be understanding of in a child with autism, and what behaviors should we handle? Should we handle as we would a neurotypical child? Is it ever okay to let negative behaviors go?
What a fantastic
Isn't it?
question. Yeah, that's a fantastic question. It really is, because I see both sides of that often. I see parents who, just because the child has the label of autism, they allow so many things to go that they shouldn't, you know, so they're very, very lenient because they just feel sorry for their child. And then I also see parents who are like nitpicky about every single thing. And I'm the one saying, this is very typical for his age, just leave it alone, you know. So that's a very, very good question. And I would say, this is sort of the brief answer, and this is what I tell parents, is treat your child the way you would like them to be in terms of, you know, I started saying this with parents many years ago where they were spoiling the child. And I was like, don't do this. If you expect your child to be recovered, to be functioning normally, then treat him as you would a typically developing child. You know, so the same answer applies here in the sense that you know your child's capabilities. Obviously, you're not going to get mad at a child who can't express themselves well because their language is delayed, right? Mm-hmm. But you know, like, you know, I reiterate this numerous times, the behaviors, the challenging behaviors that we see in our kids are not part of the symptoms. They're not required to be there if you have autism. They're a side effect. They're sort of a result of frustration. So as long as you've given your child a different way to communicate, and you know that they know how to do that, but they still choose the more challenging path, then treat them like you would your other children or any typically developing child. And, you know, the other side is true as well. If you have situations where it's very impossible or very difficult for you to deal with a situation, just let it go. Pick your battles at the same time. I have had myself with my children who are typically developing. I have scenarios where, I mean, I had with my youngest many where, you know, you'd be out in public and there's so many other things you're dealing with that you can't actually deal with the child the way you would if you were home, for instance. And it is what it is. You just deal with it and keep moving.
You know, every week we have a topic for the week, our overreaching topic that we try to touch on. And this week it's setting priorities.
Right.
And I think that's what this comes down to,
right,
really, is setting priorities. But as you were talking, I was thinking about, because I have been on both sides of this equation, and I'm still on both sides of this equation daily, trying to pick, you know, what do we focus on? What do we not focus on? What's the priority in this moment? But I think the biggest gift that ABA has given me as a parent was that it empowered me to know that if there is a challenging behavior, I can target that behavior and I can change it. I can make progress.
Right, absolutely.
And once I knew that, then I got to be in the space of, okay, but is this the behavior that I want to change right now? Is this important? Is it appropriate?
Is this the battle I want to pick?
Yeah.
Absolutely.
But
That's right.
knowing that empowerment of knowing I can change this behavior if I want to target it, if I want to take certain steps and measures and clear other decks and say, this is the thing I want to work on, just knowing that on a daily basis and knowing that for the last, 8 years, I guess, gives me the ability to breathe.
Yes.
As a parent.
The more knowledge you have, the more, you can relax about things because you know how to handle the situation. Absolutely.
And I think so many parents, part of the issue is that when you don't feel like you can change a behavior, that is a desperate clawing feeling, and you feel like you don't have any power.
It's fear.
Yeah.
It's when you don't, it's like you don't, you've entered a very scary world. Yeah. And you don't even know how to get your child out of it. That's what it is. It's fear. And I think I agree with you. It's my frustration, even now with my kids who are teenagers, is a different thing. So it's like you get fearful when they have, and especially for me as a behavior analyst and a clinical psychologist and their mom. So if they have an issue and I don't know how to solve it or how to move forward or how to help them or so on, I will have fear. I know that in myself, and I will panic, and I'll be upset and depressed and whatever it is, because I can't quite, I don't have the path.
Right.
ABA gives you the path. It does. It allows you to plan and move forward. You know, and I just want to say, sometimes the challenging behaviors of our kids are so severe that, or so repetitive, so intense in terms of, you know, it's all day long and that sort of thing, that it's just overwhelming, and we feel like, well, I know how to handle it, but I can't do this intervention every single moment. And it's like anything else. Yesterday I took the day off because I had to do a million things at home, and it was like one of those ridiculous days, you know, where I interviewed about 10 housekeepers, you know, and had phone people there, and I had, like, you know, deliveries and grocery deliveries and I mean, it was like the craziest day ever. But I thought to myself, it all went well, because for some reason I had it sort of scheduled and planned and under control, and Greg was there and he helped, and, you know, that sort of thing. But with autism, sometimes it hits the parent and you don't have any resources. You don't have any friends who can help. You don't have anyone else, and all of a sudden it's your life. And like anything else, you kind of need to get help. Like, you really do. I mean, sometimes I feel like yesterday, for instance, there's no way I could have been the one dropping the kids off and picking the kids up, because I had all these other things and Greg was there. Yeah. So you need to make sure that if you have situations that are like all day long, and in terms of ABA, everything is all day long because you want to be consistent. Get help.
Yeah.
Ask for friends to come help. Ask for neighbors. Ask for family to just spend some time helping you and giving you a little bit of time where you're not in charge.
Yeah.
Like, that's the biggest thing I fear for my families, for the parents, because I feel like the moms, like, it's huge what you have to go through. And honestly, Shannon, sometimes you heard me say this to Card today. Yeah. I feel like it's not just what, you know, our therapists do is not just help in the terms of clinical. Sometimes our therapists are important to the families because they are that the other people in that lifeboat.
Oh, yeah.
You know, they're just your support system.
Absolutely. We get attached to them. They become part of our family.
Yeah.
You know, there are still therapists that worked with us that I consider family.
Absolutely.
All these years later. And I appreciate everything that you're saying, and I also want to remind people that in the beginning, when you have a bunch of behaviors and it just seems so overwhelming.
Yes.
Remember that you can't do everything all at the same time.
And you don't want to.
Pick something.
Absolutely.
Pick something to make your battle, as you were saying, picking the battles. And it's amazing. It seems like, and we have one parent that writes in on a regular basis that I so relate to, because she says, I don't think we're going to get there. There's too many things. He's still so far behind. I don't think we're going to get there. And I always think, oh, we are related. We were cut from the same bolt of cloth, because I worried about that too. And yet, you know, the image that somebody told me was when you go to climb a mountain and you're standing, and I know that there are some people right now, even today, that are finishing climbing the most unscalable mountain this morning. But when you stand at the bottom of the mountain and look up, it's insurmountable. Yep. But once you're climbing up, you can't always see the peak while you're climbing the mountain, but every step you take gets you closer there.
Absolutely.
And to remember to focus on the path, not the peak, once you know where you're going.
That's absolutely right. And what a great point. I mean, and you mentioned just today, for instance, there are parents today who received a diagnosis of recovery, you know, and they 3, 4, 5 years ago were where some other parents are today, which is, I just got my diagnosis. What the heck am I going to do? Yeah. So, you know, it is definitely a mountain you can climb. You just need to get your resources.
Yeah, one step at a time. Now, I mentioned before the break, we've had several questions come in on the live feature and in our email and even on Facebook of parents being concerned that at the end of this last year, they were asked to get a corroborating diagnosis. The question has come in many, many different ways. This most recent one, we are required a confirmation of a previous diagnosis of autism spectrum disorder. Please kindly recommend the best option to secondarily confirm the given diagnosis. But we've had that come in at least 45 different ways.
Yeah. And, it's been a while now. I mean, once a diagnostic, and okay, so to answer some of those parents who are asking about this sort of thing, it is a gray area, but having said that, in the DSM-5, it actually states that they will, a diagnosis of DSM-4 will be honored, sort of should be honored.
Yeah, we were all hearing grandfathered, that we'd all be grandfathered in and it would not be in question.
However, having said that, over a period of time, you ultimately have to kind of adjust to the new criteria. So I'm trying to think of a simile in life or something like that. And it's like, let's say so here's a good example. This is actually a great example for those of you who are iPhone users. So if you're an iPhone user, you can keep going on your current iPhone settings, right? But every once in a while, they do this annoying thing which requires an update.
Right.
And you can ignore that and not do your update. But as more and more time goes on, you fall behind because more and more features become unavailable to you because you haven't done the update. And things start to get screwed up.
Yeah.
So it's kind of like getting an update. When you do your DSM-5, there's some things that are different. And honestly, although a lot of people had negative thoughts about DSM-5, mine were all pretty positive because, for instance, it is the first time ever that we acknowledge the existence of sensory issues in autism. This is the first time in the history of autism that one of the diagnostic criteria has to do with sensory dysregulation. Now, this is a very important thing because we've never even acknowledged before that our kids have sensory dysregulation and issues with their sensory input. So, it would be important for your child to receive, if you have a child, which many children have sensory issues, it would be important to have that in the child's diagnosis because then whoever's doing intervention or treatment is going to address that. And it's not going to be left, just to its own, which has been the case for years and years. I mean, we've known for many years that kids have sensory issues, and it's only because I really pay attention to the kids' symptoms that we've been doing intervention, but most people don't do anything with that.
Yeah.
So it's very important that the diagnosis actually it's a better diagnosis. Another feature that's been added is the existence of medical issues. So there's all these other things that bring attention to who the child really is. I would imagine that for parents who have a diagnosis of Asperger's from 2004, it's a little scary because Asperger's doesn't exist now. But DSM-5 does allow you to do the diagnosis as ASD, Asperger's type. So this is kind of a good thing. The other thing that DSM-5 does is that it has a severity factor on both social and on communication. And so if you receive that this year, let's say, and you get a severity that shows high level of severity, let's say a 3, you'll be looking to see if you've improved to a 2 to a 1 next year or the year after and so on, or if you're going in the wrong direction, in which case you have to switch interventions. So it is a better diagnosis, and although it's a headache, it's important ultimately. I mean, you've waited, it's now over a year, so it's kind of important to go ahead and get that re-diagnosis.
Okay. Now, so you talked a little bit about some of the possible fears, because what I see as a parent is that, while this is the best possible thing for the best possible treatment, I think that we all know what's driving people to ask us to get the secondary diagnosis is that they want to weed out people who don't need services. And a lot of times, I think there are a lot of people who have probably started ABA. They're seeing progress. They're excited. They know they're not done. They know they need to be continuing on with ABA, and they're afraid if they go and get a diagnosis that this is, in their wildest imagination, their best quality problem, right? That their child may not qualify anymore for the diagnosis, which doesn't mean their child is fully done with their program, but they're going to lose their funding. So I know that parents are concerned about that. What advice do you have for us if that's the boat we're in?
The advice, I suppose, is on the one hand, enjoy the fact that your child has gotten to a point where they're not getting a diagnosis anymore. Secondly, a lot of kids will do really well if you have a, well-trained speech pathologist. If you're a high-functioning child and you have some language issues, you can also divert to speech, which is covered through insurance. Okay. But having said that, because you have the 1, 2, and 3 criteria, the severity levels, it allows you, I don't think that it's going to eliminate children. It's going to it's a broader diagnosis. In other words, kids who in the past, here's a good example. In the past, if you had a diagnosis of PDD-NOS, you wouldn't get regional center funding, right? Now, PDD-NOS will be a 1 rating the ASD diagnosis. Right. So you will now get it because it's all ASD. If you had Asperger's, you wouldn't get funding. You will now because it's ASD. So, if you're the person diagnosing is kind of aware of all the sides of this, and if they actually follow the rules correctly, the DSM rules correctly, I don't think it's going to eliminate people. Well, I wouldn't worry about that.
Well, I think what you've brought up is, I think, the key point, that you need to get the right person doing the diagnosis.
You do.
That isn't tied to the funding, first of all. That isn't dependent upon the funding. And I know that CARD has assessment centers that people...
We do. We have an
assessment
center. Yes, of course. I mean, we have an assessment center. You don't need a full... Okay, so here's... If you know a clinician who's been around for a long time, like me, I diagnose. I don't need a tool to diagnose, right? I don't need to administer an ADOS or something to diagnose. I will meet the child, the family, and I will interview them and ask questions and see how the child is behaving, and I will diagnose. So, and that is, I guess, because of the fact that I've been licensed for so many years and in practice for so many years, nobody really questions my diagnosis. An insurance company will not question my diagnosis. If it's a new clinician, if it's a new diagnostician, like a new psychologist, then, BCBAs cannot diagnose, okay? Right. So they cannot assess for diagnosis. So you need a licensed psychologist. If it's someone new, I definitely suggest that you get an assessment done, which is an ADOS, or, there's other assessments. ADOS is sort of the gold standard at this point, but there's many others that are just as good. And because I don't think that our newer clinicians are able to, they don't know autism well enough. Let's just put it that way, newer clinicians. So at CARD, we have licensed psychologists, and they diagnose, and they also do administer ADOS. Our pediatrician, Dr. Copeland, also, because she's not only a pediatrician, but she's a developmental pediatrician, she also diagnoses, and she also administers the ADOS. And we all love to do that. And at our, our assessment center is in Woodland Hills. Dr. Copeland is in Sacramento. We have several MFTs who are licensed and trained to diagnose. Vince Redmond, who's been on the show many times, can diagnose. And I am happy to diagnose, as I was telling you earlier, diagnosing kids, not that it's one of my happiest activities, it's not, but I'm very accurate. And I like to help families. I like to have contact with families, with parents, and be able to explain to them what it means, and make sure that they don't, that their life doesn't depend on a diagnosis. It really doesn't. So as I said, I diagnose all day long if I could. And I will be traveling this year.
Okay.
I'll be traveling to all of our sites because of the 25th anniversary of CARD. So I'm going to be in a lot of different locations, and I'm happy if you're a parent who's near a CARD site, contact CARD at our 800 number and just say, I really want to get a diagnosis. and then I will share with you my schedule so that you'll know when I'm going to be hitting your site, if that's helpful.
Okay.
And I'm sure otherwise there are lots of psychologists who are able to do this as well now.
And I always suggest, if that's the way you're going to go, make sure that you consult. You always have to have 2 support groups online, one that's local, one that's global. Consult with your one that's local and ask them who locally is somebody who's reputable and not tied to the funding dollars, who might be swayed by some other entity.
Yeah,
shouldn't be, but I know that
there
sometimes...
shouldn't be. I mean, a licensed psychologist should not, unless they're working for your insurance company, for instance.
Right.
You don't want that. You don't want someone who's working for the funding agency. You basically want a neutral person.
Exactly.
And all of that should be funded because we're all licensed then. So, and I am licensed in numerous other states as well, so I can test everywhere.
Wonderful. All right. So if you want more information about that, make sure you can go to centerforautism.com. You'll find the 800 number there. You can also click on the locations to see what office might be closest to you. I want to move now to a question that came in on the live feature this morning about toilet training. Hello and good morning. I love the show. We love you too. Can you please get me started on how to go about toilet training my 5-year-old? It's something I really want to start on, but I don't know if my daughter is ready. She communicates with about 10 different signs, but none of them are potty or toilet. Any suggestions would be appreciated.
Yes. It's actually a very easy and straightforward procedure. It doesn't necessarily require that she would sign potty yet. So I'll just do a quick review of it. But I mean, I don't want you to follow this. I think we've listed the procedure in our book. And if not, go on IBT's website and there's definitely a module about toilet training. Okay. But essentially the procedure is sort of, you start with, you take the bathroom that you really want to, I haven't done toilet training in ages, but it's fun. You take a bathroom, which is going to be the location where you want the child to really focus on or go to. And it should be easily accessible. It should be the bathroom that's the closest to wherever the child's kind of hanging out most of the time. And you make that bathroom lovely. You turn that bathroom into Disneyland. So you put a TV in there if you can, with like the child's favorite videos or DVDs or whatever, books, all sorts of toys, fun stuff, like a beautiful place, right?
It's the place they want to go.
It's the place that they will want to go and they'll love going. It's their reinforcing place. And you'll be treating the toilet as a chair, essentially, and your child is going to be spending a lot of time there. So let's say the day that you're initiating this, the day before, you want to give your child a bunch of salty foods so that the day that this happens, they're going to be drinking a lot of water. They're going to be thirsty. And you'll be giving a lot of salty foods throughout the day anyway, and just like water, 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 because you want urination to happen frequently, more frequently than it would, only because it'll give you a lot of practice time, the ability to practice the skill. So you're in the bathroom and your child will be more or less naked from the waist down during the day when you start. And what you'll be doing is you start in the bathroom and the child is sitting on the toilet and essentially you'll wait. And so you're engaging the child and you'll wait until they go. Okay. And because of the fact that they're sitting there, they'll ultimately eventually go. And then what you do is when they go, they get to get off the toilet and have some sort of celebration. And who cares what it is? You're giving them their favorite reinforcers that day, whether it's food or whatever they want, they get for going. And then that's the whole idea throughout the day. Now, the key to it is that you start with a longer schedule on the toilet, shorter breaks, and throughout the course of the day that reverses. So you're increasing the duration of the break. So let's say you start with, we generally don't want to keep our kids off for more than about 10 minutes on a successful potty training schedule. So they're on, it could be 30 minutes, an hour before they want to go. And they're drinking liquids the whole time, and they're busy doing other stuff. And you'll have to let them stand and sit once in a while just so there's blood flowing in their legs. And then they're off for 10 minutes or 15 minutes maybe, and then they're back on. And you can play with this, and then gradually during the course of the day, the on period will be less and less because the child will, because you're increasing the 10 minutes. Going to 15 to 20 to 25, and the child will realize that, oh, as soon as I urinate, I get off. And so that kind of becomes a reward for them to urinate and come off. Several things will happen, which is too lengthy for me to go into detail here, but you'll have accidents. It's no big deal. When you have an accident, you help the child clean up, you have them go back on, and you go back to the prior schedule. So you go step back where the child was successful. You always want to keep your child successful. And essentially that's what you do for today. Tomorrow, by the end of the day, you hope to be at a point where your child can stay off for an hour. Possibly. It could even be a half hour. But wherever they get, your goal is that when they go to the bathroom, they know it's for the purpose of urination, and then they're off. And where you want to get by the end of the first day is on a schedule, which means that every hour you take your child. They're not supposed to be telling you, I need to go. You simply take them there. And when they go there, because they've now learned, they've been conditioned that this is what this location is for, they will immediately urinate, and then they'll go out, and then you'll reinforce that. By the second day, you'll take the child basically on the hour. You stay on that hour schedule for a while. And as you're on that 1 hour schedule, then you will, depending on your child's communication abilities, you'll either have them start telling you by saying potty. Every hour you'll say potty, or you want to go to the bathroom, and the child even can echo or imitate what you said. Or you could have a little picture of the child, and all they have to do is touch it. But you'd have to have that picture everywhere, right? And they touch it in different rooms and so on. And so ultimately the child gets the connection that when I touch this picture or when I say potty, they take me there, and then I can go. And so every step of the way, you're giving your child a little bit more autonomy, a little bit more ability to be out there and running around, but it's a backward shaping procedure, and you are gradually fading your control out. It's not it's not like it'll take a while, weeks, maybe months, before the child is able to just simply say, I have to go to the bathroom, and go whenever they want to go. That's not your initial goal. Your initial goal is simply to just have the child void in the bathroom, in the toilet. And you're not dealing with bowel movements right now. You're just focused on urination. So a lot of the other time, like overnight, you'll still have the child in pull-ups or diapers or whatever it is, because you have also not dealt with overnight. So, if you're lucky, you'll also catch a bowel movement. The main thing is you just want to be really celebratory when the child actually voids. That's a big, big deal. And a lot of our kids just enjoy that reinforcer so much, and they connect it to what they just did.
I want to start by saying the difference between behavioral therapists and the rest of us is that when we said to you toilet training, you said, "Oh, that's so fun."
It is
and
fun.
That's the difference. Yeah, the rest of us go, "Oh, toilet training." Behavioral therapists go, "Oh, this is fun," because you have the confidence that you know it can happen. And the other thing, and I've told this story before, so I'm going to tell it very briefly, that when we were toilet training, Jem, it got so ingrained in us that when somebody urinates, that we go, "Yay!" It's so exciting. That we were in this building upstairs at a clinic, and my husband excused himself from the clinic to go across the hallway to the bathroom, and you can hear everything from those bathrooms in the clinic rooms. And we were there with Jem, with all the therapists, and all of a sudden when my husband was in the bathroom, we heard "Yay!" because we had gotten in the habit of doing that ourselves, that when we would urinate, we'd go "Weepy!"
Yes.
And it just cracks me up. That's how ingrained it became.
It is fun. I mean, I know for parents it's like, oh my God, I got to deal with this.
Oh yeah.
But I used to, when I was a therapist, when I was much younger, and I used to do a lot of therapy, it was my thing. Like, I loved going to people's homes because I'd get the whole thing done in a weekend.
Yeah.
And I was just so happy with myself because, like, oh my God, I knew going in that by the end of this weekend, this child's going to be done, you know?
And it's life-changing. It's life-changing for them. It's life-changing for the family.
Absolutely.
It's so exciting when they get it. It's exciting for the child. And I think now, having gone through it successfully, I think if you're not having a good time while you're doing it, you're not doing it right.
But it's a complicated procedure. It's not an easy procedure. Because there's so many other things, Shannon, that happen. For instance, sometimes our kids actually, especially the boys, they'll urinate at you or out because of the attention they get for it. Yeah. So there's a lot of, like, they could go the wrong path because they're getting attention.
Yeah.
And so I really do recommend that if you're going to be doing a really good toilet training procedure, which we use a sort of a similar version to the Fox and Azrin procedure, I would really suggest that you get a BCBA to help you with this, because it's important. And I am pretty sure that we have instructional modules on IBT's website about this, and I would really recommend it's kind of like watching a YouTube video, so I would really say please do that, because it's really important.
Get your ducks all in a row. You'll really want to do that. And again, that's at ibehavioraltraining.com. Questions. We had a question come in from a viewer. Hi, Shannon and Dr. G. Mm-hmm. My son is almost 5 and in a typical preschool. He has some language and can trace words but not copy. He will imitate kids when he plays and sometimes initiate. His ABA goes 2 times a week. And I don't know whether that means the ABA goes with him to school 2 times a week or that they're coming home 2 times a week. Mm-hmm. It sounds like school. She says, she goes on to say, she tells me he is almost at 60% with his goals. He doesn't have disruptive behaviors to others, but has difficulty with staying focused and attention. The teacher says she constantly has to tell him or tap him to get his attention during circle time. He has difficulty with seat work as well. He is easily distracted and not motivated to do his work. They tell me he can be lazy. And she says, LOL. Do you have any suggestions? Thank you for your awesome show. I'm with you. Whenever anybody says that a child with autism is lazy, I go, you have no idea what you're talking about.
Absolutely.
These kids work harder than anybody else to be in your world.
My God.
And to do 40 hours of work a week to struggle to be in your world. Anybody else,
I agree.
They have the best work ethic of anybody I know.
There were a lot of symptoms there.
Yes. But very distracted during seat work and circle time. Teachers having to constantly tell him or tap him to get attention.
Right.
Not motivated to do his work.
Right.
But a lot of pluses here.
I know, absolutely, but I have a lot of questions. So, for instance, why is the teacher tapping him if he has an aide?
It might just be that the aide is only going twice a week.
Right. So, and the child is how old?
5. In a typical preschool.
Typical preschool, and did the parents say anything about his language?
No.
He's tracing but not copying.
He's imitating and sometimes initiating with other kids. So I think the language has to be somewhat there. Yeah. No disruptive behavior, but difficulty with staying focused and attention.
Right. So you talked about a few different things. And some aren't in the email. So one thing is, of course, his language ability is the most important at this point if he's in regular ed school, because we want to make sure that the child is able to interact with other kids. So that is number one. And if you have, so let's assume he's doing pretty well in communication, but has further to go. Then the second area is, you mentioned he's tracing but not copying. That's a really easy skill to teach. I don't know if he has any fine motor issues that need to be addressed, any visual motor issues that need to be addressed, but it's not a difficult transition to go from tracing to copying. So, whoever is working on that with him maybe should be changing their technique. It's not something that's hard. If he has the correct grasp, the pincer grasp, and if he is tracing, it's a gradual procedure. I mean, going to copying, essentially, you just have sections of the word missing. So let's say you're doing an A. What you would do is you'd have a full A and he's tracing it initially, and then you'd have a full A missing the middle line, let's say, and then now he's writing it himself. So, and you gradually make it more and more so that he's writing it himself. So that's copying. I mean, but that's not a typically difficult transition. His distractibility, welcome to the world of autism. I mean, all of our kids are distractible.
Welcome to the world that we live in with technology everywhere. That I bet if you were to look, some of the neurotypical kids are having problems as well.
Well, absolutely. And I was going to say, welcome to the world of toxic food.
Yeah,
I mean, there's a million reasons that our kids are distractible. There's a million reasons that our kids have high levels of ADHD. It's funny because for like 10, 20 years, everybody was saying, oh, the ADD diagnosis is increasing and it must be fake. Like there's so many kids, but part of that is just that there are more and more kids, not that are hyperactive, but that are distractible. And that's the other form of ADHD, which is the distractibility. And it's increasing, and it is partially because they're distracted by technology. I mean, sometimes I go out with my kids and everybody is sitting there with their phones like this, and there's like no social behavior at all anymore. It's okay. It just is the new world.
Mom has written in to let us know that he does have 25 hours of ABA at home.
Great.
And he has some language. So I think you hit it right on the head. Okay, he's got some, but it could progress.
Great. So the number one thing I want to say here, he's 5. 25 hours at home is pretty good. I want to make sure he has at least 15 at school. Okay. So that we're hitting 40. I'm not even completely happy with that. My preference would be that it was all at home, but when we hit 5, I know that we have to start going into school. Right. I tend to want, let's assume he's but this is where I want my kids when they go to school. I don't care about fine motor. I care about social and language. I want to get the social and language under control. I want to get the child to a point where they are interacting with other peers, able to follow instructions with the teacher. And academically, most of my kids, if not all, are not only able to keep up, but they're ahead of other kids. So, the fine motor stuff is easy, the tracing and so on. You should easily be able to teach those things. Make sure that the aide is the one that's working on keeping his attention. If he still needs more direct instruction, make sure it's the aide giving it to him, and then gradually start to get his attention on the teacher. There's many things you can do. For instance, we would, wherever the teacher is standing, let's say on the whiteboard, we would have a little sticker and we would teach our child, you need to be paying attention to the sticker. Another very, very good source for attention is these watchminders. There's watches that you can program that every, I think 10 minutes or so, it'll actually say, look at teacher. And it'll buzz, it'll vibrate on your arm and it'll say, look at teacher, or it'll say anything else you want it to say. You can program it to write that. But your child has to be able to read, or someone can teach your child that whenever it vibrates, you need to look and pay attention. That's an easy thing to teach. That's conditioning. Yeah. It's a bell going off, like a vibrator going off on your child's arm, and then the child being conditioned that every time this vibrates, I should listen to the teacher who's talking and see what she says and understand that. But all of these were just a summary of numerous preparatory lessons. So I sort of, because it doesn't sound like he's a card child. And with our kids, we prepare them with a lot of these different things. There's a lot of language preparation, but then there's a lot of executive functioning preparation and sort of, what are the salient things to pay attention to. We test those things along the way, and it's kind of like, does he have all the school readiness skills? Perhaps you would benefit. It sounds like you've done well in terms of getting him to where he is, and that he has 25 hours at home and he has an aide at school. You definitely want to have an aide at school. What I recommend is that you actually play around with skills a little bit. So become a skills member and do the assessment. You'll be, children like your son are the perfect skills candidates because they're sort of a little bit in the middle, maybe towards the end, but they're in the middle of the whole thing, and you'll see the whole universe of things that you have to teach and what's left and how much time is left. And and it'll guide you. It'll tell you exactly, if you do the assessment, you'll see how far he is all in each area, advanced and delayed. So you'll be able to see where his language is, social, academically, adaptively, cognitively, his executive functioning skills, his play skills, his social, everything. So that'll be wonderful for you. And anything that he's not at age, skills will give you lessons and tell you how to teach them. This year I told IBT, our Institute for Behavioral Training, who also provide our training to our supervisors. I asked their director, Cecilia Knight, to focus on developing skill teaching videos, just a lot of videos for parents, just teaching stuff, all the lessons from skills, actually. So it's kind of like, how do I teach attention? Do we have many, many lessons to increase attention, many, many lessons to reduce distractibility. And so I'd like to be able to kind of produce those videos as well. But right now they're written out in very detailed format. There's small video samples, and there's IEP goals. There's all sorts of resources and skills for you.
And just yesterday when we were talking about setting priorities, I had suggested to everyone to start getting ready for IEPs now by doing the assessment and skills. So not only will this help you now, but it'll set you up for your IEP that's going to come in a couple of months, so that you're going to get the best possible first grade year with the right goals, because you'll be an empowered member of that team going in. You'll know exactly, you get a great snapshot on skills of where your child is and where they need to get and how to do it.
Absolutely.
Which is amazing. Okay, so then moving on to our next question, somebody wrote in about starting with skills. Hi, Shannon and Dr. Doreen. How do I get started quickly with skills? My son is turning 5 and has been using the VB map with ABA, and I keep asking them to do skills. I need to train them on how to use it. Is there a video we can watch or someone we can speak to help us get familiar with how to get started with skills as fast as possible? And thank you so much.
Yes.
Now, I feel a little guilty because one of the things that's on my list of things to do is to make this video.
There is a video. There is a training video that Adele did a while ago. So there is a video that kind of shows you how to use skills. But yeah, we did want you to do a more, detailed.
A parent one.
And a more detailed one. Yes. I would really appreciate that. I think a lot of parents would as well.
So here's what I want to say to you is that I would like to do a practice session before we do the video. So if you will write to me at s.penrod@autism-live, then I would be happy to get on the phone with you and we can do a share on our computers. And I could do that this Friday.
That's wonderful.
You and I could walk through it. It would be a good refresher for me for the point of view of somebody starting new, because I've been using it so long. I think I've forgotten what it was like on the first day, so it would be great to do a refresher before I need to get the video together.
That's wonderful. But I mean, essentially what you want to do at this point is, once you've registered and put in some demographics, just date of birth and so on, you will go straight to the assessment, and the assessment will generate questions based on your child's age. So if you have a 5-year-old, it will give you, and it doesn't matter, pick any area. It doesn't matter. Ultimately, you're going to answer all the areas. So you'll start getting questions. And there's a lot of questions. So, and the questions are yes or no. And if you don't understand exactly what a question means, just hit the example button, and the examples are very, very good. I always understand the examples.
Oh, yes, it's a world different. And I will say this, I mean, I didn't have a tutorial when I sat down to play with skills. I don't think that everybody needs one. I think we want to be able to give you something so that you know all the ways to use it and to utilize it. But the truth is that anybody could sit down and start using skills.
Absolutely.
I did. And I'm not a tech whiz.
I mean, and essentially the concept with skills is, once you've answered all these assessment questions, you've identified what your child can and cannot do at this moment in time. You don't have to be 100% accurate. It doesn't matter, because the system will catch it. Everything in skills is built sort of upon each other. Like, you cannot do an advanced skill if you don't have the precursor skills. So if you say, yes, my child can do the advanced skill, but then you say, no, my child can't do all these precursor skills, the system will just assume he can't fully do the advanced skill and will ask you again later. So don't worry about that. Just answer what you think your child can and cannot do. everything your child cannot do will then go into a pool that will be connected to a lesson. So whatever he can, and it'll be ordered for you in terms of youth. So the younger skills will be given to you first. And that's it. And then you'll be given a massive supermarket of things you're supposed to teach your child. And the key to it then is picking what you think you can handle based on the hours. One of the things we're building into skills now this year is an algorithm that'll do two things. So you'll say how many hours of ABA you're going to be doing, and it'll give you the number of lessons that we think you could probably do in that period of time. Then it'll also give you a breakdown of how many lessons in each area we want you to do based on what you answered about your child.
Great.
So if you answered all the questions and it shows that your child's biggest deficit, let's say, is not language, it's executive functioning, then we'll have you focus more on executive functioning lessons. If your child is older and you said there's a lot of things in language that are missing, we'll have you do more of that sort of thing.
Okay. We've only got 2 minutes left,
Okay.
and we've got a big, long question that's important. So
Sure.
I'm not going to post this because the person gave us their name, but they said, I'm suffering from depression, or at least I think I'm suffering from it. The reason I'm saying this is because I was diagnosed with depression in 2012, and I was diagnosed with high-functioning autism last year. And so I think the depression has gone away from me, but at the same time, I feel as if it's still there. So what I would like to know, that can autism make a person think that they are still depressed just because they had depression before? How can a person know when they do something that they are stimming or that they have obsessive compulsive disorder? Is there a difference? Basically, everything that I do repeatedly. And so I would like to know, am I stimming or do I have obsessive compulsive disorder? I feel as if I'm living in my own world, and it has gotten to the point where I think I am a retard. And so I would like to know, does retardation share the same qualities as autism? Am I socially retarded?
Oh my God.
I know, big long question that we aren't going to be able to get through the whole thing.
No, but I can give some guidance real quickly. So, no, first of all, retardation has nothing to do with this. If you're concerned about your intelligence, that's what retardation has to do with, then go see someone who can give you an intelligence test, an IQ test.
But
that's
clearly somebody who can write this email.
Yes, exactly. This has really nothing to do with how you're feeling. When you have thoughts of depression, and if you are having some symptoms of obsessive compulsive disorder, it's all related. So let me explain that a little bit. When you have autism, what autism does is that it makes it hard for you to receive information from your environment and process the information the same as other people, as typically developing people. So you might be someone who is a little bit focused on your inner thoughts more, and so having a difficult time receiving information because you're distracted by your inner thoughts. You might be someone who's a little bit anxious. My personal feeling hearing what you wrote is that you're experiencing a little bit of anxiety. You're worried that you have all these things and what's going to happen to you. So you're fearful. And when one becomes worried and anxious, we tend to do repetitive things more because they give us a sense of calm, because they give us a feeling that we have things under control. So what you're doing is you're perpetuating this cycle. So you get worried that, do I have depression? And then you do repetitive things, because that's the nature of all people, is to do repetitive things in order to calm ourselves. Then you actually do reach a level of obsessive compulsiveness, which then depresses you because you worry about that even more. Now, that whole cycle, interestingly enough, the three things that you mentioned, depression, autism, and OCD, are all related, and their connection is anxiety. They all have an aspect of anxiety. Obsessive compulsive behavior is completely an anxiety type disorder. Depression is the internalization of anxiety, and autism many people with autism have anxiety because they don't feel like they can fit in. So if I have one suggestion for you is to find a very good psychiatrist, because the medication that's given for all three will benefit all three, is a selective serotonin reuptake inhibitor, SSRI. These are medications like Prozac, Paxil, Zoloft, Luvox, there's many. Those medications work on exactly obsessive compulsive stuff, anxiety related stuff, and depression. So it's the perfect thing for you. And if you enter therapy, psychological therapy, I think it would also help you. It's important to deal with the anxiety and the depression right now and not worry tremendously about the high-functioning autism. The high-functioning autism becomes a factor if it leads to you not being able to have a job or go to school or function in the environment. If you're able to do those things, then you're fine. Your skill level is good enough. It can always improve, but it's not the primary issue. The primary issue right now is dealing with your anxiety. So focus on that, because that's what's leading to all the repetitive stuff.